All right, roof down or up?
Let's go roof down. It's a beautiful day today.
Hold up.
Damn, this is so sick.
That's it. See how the whole back comes out?
Yeah.
And just like that, we're in a Tiger Top.
I'm not gonna lie, probably a better choice than the McLaren, in my opinion.
Look, it's a safer choice, and I don't think I'll lose my license as easily in this one.
That's also fair.
The McLaren was... You know what the McLaren's like? It's like a go-kart.
I can feel that.
So it's low to the ground, responsive as hell, but it wants to like... This feels like a caged beast. That feels like a caged monster.
Yeah.
Tell me, what are we talking about today?
Well, I think the main thing that I've been like running through with Jessie and I guess like brainstorming with her as well is I'm a bit at like I guess a crossroads of where I want to be next year.
Right.
In the sense that, so I guess the current situation is I do 2 days public at like where Chris used to work.
Yes.
And I do 3 days now.
Yep.
I feel like I'm getting a bit restricted in my growth at public, especially since I started doing
Right.
because I feel like there's a lot of things I want to do and the scope to do that is not really there. The main, I guess, advantage that I can see it being in public is that there's a bit more exposure to surgical procedures.
Yep.
And also there's some support and mentorship in that arena as well.
In extractions only?
Well, mainly surgical extractions.
Okay,
and I think the arrangement that I've got with the boss there is that he's much more open for me to do surgical procedures there.
Yeah.
And there's 2 kind of like main dentists who are happy to help as well, 2 or 3. So it's like beneficial in that sense. But I'd feel like that would be about as much as I'm gaining from the public setting at the moment.
Yeah.
It's really fantastic and I really love it. And it's...
There's a bit of a hill climb.
Oh. Yeah, she really does go, hey.
Yeah. It really likes to take off. That noise.
It is a guttural noise as well.
Yeah.
Oh, this is so good. Surely this is the first road you took it to as soon as you picked it up from
Hell
here,
yes.
right?
When I have a bad day, this is the road that I
Take
come
up.
on.
Jeez. And it feels so grippy as well on the road too. Oh
Yeah,
my
well,
God.
it's 4-wheel drive, right? 4S?
Yeah, okay, gotcha.
It's funny, did a few reviews on this car. They were always like, the Targa's a bit heavier, the only people that buy these cars are dentists. I'm like, well, yeah,
I'm a
okay.
dentist. But no, it's like I was saying, like, really good, and it's been a really big learning curve. It's my first private practice as well, so it's been a bit...
and what a private practice to
start
pick.
off in, right? So it's been a completely, like a very big learning curve because it is on the complete other side of the spectrum of what I've been practicing.
Yeah.
Because I started off at the hospital during my first year.
Okay, so you did 1 year at the hospital?
Yeah, so I did
So
1
all
year
public?
in at the hospital there. And the only reason I came back to Melbourne was so I could join. Because I got kind of asked if I wanted to join, and then I didn't really know anything about it. So I was like, yeah, I'll join.
Yeah.
One of our old supervisors, like a clinical supervisor at the hospital, she kind of just sent me a message out of the blue and was like, you know, there's a position going. It was her position. She was dropping down days, and she was like, I kind of remember you from like, you know, your year level.
Yeah.
And I thought I'd just send you a message because I knew you were in.
Yeah.
Do you want to would you consider joining?
Yeah.
And I was like, yeah, okay. But I didn't really know anything about it at the time, nor did I know like what kind of practice it was going to be.
Yeah.
So I kind of just went in blindly, and then I found out. I was like, wow, okay, this is a very different and unique practice to what a lot of dental practices are.
What do you find is most unique about it?
Well, I feel like for me, it's the scope of, I guess, treatment we can offer. It's the possibilities are pretty much endless, really.
Yeah.
I felt that when I was in public, especially at the hospital and now there's always a restriction on what we can offer, and it's never always going to be the best treatment as well, whether it's like materials or treatment options or treatment choices.
Right.
Whereas here, it's kind of like, well, these are the options, you know. You
Yeah.
have a chat with the patient, and then see what they want to do, and
And if they say yes, you can do
they
it.
say yes, yeah, we go for it.
Right. Okay.
And it's really, since joining and then doing on top, it's given me much more of an appreciation as to how much detail and like care actually goes towards anything, from like whether it's just a filling, or if it's like anterior crown work, or if it's like aesthetic work.
Yeah.
And that's where I'm like, now I'm a little bit stuck in the sense of like, where do I want to go next year? What do I kind of want to head towards? And what I should be looking at to focus in the next couple of years as well. Because to be honest with you, like when I was at the hospital, I was like, yep, I'm probably going to do the grad dip of oral surge in Sydney.
Yes.
And I was like, this is like what I love to do, because my boss back then was an oral surgeon.
Yeah.
And I was like, I just want to do what you want to do. I'm happy to slice and dice and go for it, right?
Yeah.
Whereas now joining, it's completely changed.
Yes. They barely do any surgicals, I'm guessing.
Yeah, I mean, like we do some, but again, it's more like I'm much more into the prosthetic aspect now.
Yeah.
I really like the idea of, crown and bridge work. I do like the idea of like implant work as well, and that's where I thought, my two passions could like intersect between prosthetic and also getting that surgical aspect still, because I still do like it. I really do enjoy it. But again, like my mindset has shifted a little bit, and now I'm kind of, I wouldn't say stuck, but more like at a crossroads of like, how do I keep going and how do I keep pushing it, I guess, because from first to second year it was like, I had a plan, I had a goal, and like I knew which way I had to go.
Yes.
But now I'm kind of like, okay, well,
Is that the way I want to go?
yeah, is that the way I want to go? Or do I just
Right.
stay and keep doing what I'm doing now? Or do I need to change it up a little bit and maybe like consider dropping the public? Like, have I gotten as much as I am going to get out of the public?
Right.
And is it like, I guess, time efficient to dedicate maybe what would probably end up being another 6 months a year in public just for a little bit more surgical experience? Or could I use that time wisely in terms of that extra day or two? That's where I'm at the moment.
Sure.
And that's the main kind of, I guess,
Right. Your dilemma.
Yeah.
Right. So I guess you hit the nail on the head where you alluded to whoever your mentor is, you tend to want to emulate what they're doing. So when your mentor is a Max Fax, you're like, well, I want to do surgical.
Yeah, this is really
now
good,
your
right?
mentor is prosthetic. You're like, do I want to do prosthetic?
Yeah.
And so this is why it's really important to get a good mentor early on. Because if you don't, you end up going down a path which you think is good, but may not necessarily be that way.
Exactly, yeah.
In your profession, I guess 20 years from now, what do you want to be doing?
I want to be doing what we do, or like what my bosses are doing at the moment. So that's
Which is what?
mainly full mouth rehabs, looking at
all-on X's, or are we talking about crown and bridge, or what are we talking about?
We're talking, well, bit of both, I would say. I think it'll be interesting to do, let's say, all on four or whatever it is, because I do like that surgical aspect.
Yep.
But also, I've gotten a much greater appreciation to aesthetics and that kind of crown and bridge full mouth rehabs as well.
Okay.
Which is what I think, now that I've been reading more and I've been studying more and learning more about all of that, I found really interesting and really engaging. And just going in and watching them work has been very, very interesting as well.
Now, do you think that's just because it's all new and glittery and nice to you right now, or do you think this is it?
No, I think I think it's more so because when I like read about it and when I'm studying it, I'm doing it more so because I like to.
Right.
Whereas when I was trying to do that for endo, for example, I really had to push myself to like sit down and like study it, and I just, it wasn't really grabbing my attention. Whereas I've ended up buying some aesthetic test books. When I'm at Fentree Gully supervising, I'll always have a couple of journal articles on like pros stuff up on the side, and just kind of like skimming through it, and it's like, it keeps me entertained. It's really interesting for me anyway.
Okay.
So I think that is more of an interest rather than just a kind of, that's the new environment I'm in and that's the kind of glitzy, glamorous stuff.
Yeah. All right. So then the next part of that question is really, do you want to see yourself in 20 years being the one actually doing all the work and physically still working as a dentist? Or do you want to be sitting back managing other people to do that kind of work?
So I think for me personally, it'll be a bit of both. I would want to be still doing a bit of hands-on, so maybe ideally 1 to 2 days a week. But also I do see myself entering the business side of things as well. So,
Well, let's say you had to pick one. Which one would you pick? You don't get to hedge your bets here.
I'd say probably it's a really tough one. Actually, I hadn't thought about that.
Mm-hmm. That's why here we ask the tough questions.
See,
Coaching's
my
a lot about
logical
making
brain
you think. Yeah.
tells me that, like, in 20 years' time, I want to be sitting back managing people.
Yeah.
But the passionate side of me is like, no, I still want to keep doing it myself.
Okay, well, let's break that down. Why is your logical brain telling you you should sit back managing people?
Well, this is more just, I guess, from like the way I've been brought up, but it's more the fact that at the end of the day, my body has like a finite lifespan, right? But
Right.
business is where you would generate, I guess, more something that's going to last a bit longer, and it's not necessarily dependent on what my abilities are. For example, like, is my back still going to be really good in 20 years' time? Am I still going to be able to do things like, I guess, technically the things that I want to do as well? Whereas if I can generate a business and have a business behind me where I can have my own patients but also manage other people as well,
Yeah.
I think that's something that would provide a sense of security for myself in about 20 years' time. For myself and my, I guess, future family too.
Yeah. Well, the first question is, yes, your back will still be okay in 20 years. Look at this duck. But only if you look after it.
Yeah, exactly. Right.
You've got to. There's some power-ups in life, and I think I'm talking about this, which if you can get when you're younger,
Yeah.
it pays dividends as you go on.
Yeah.
So one is financial power-ups, understanding how finances work.
Yeah.
The second one is health.
Yeah.
So if you know how to look after your back and how to make sure you position the patient and you look at your posture and that kind of stuff, then yes, you can have 20, 30, even 40 years without, being a decrepit old dentist.
Yeah, hunchback.
I've always said I didn't want to be the guy driving the Porsche when I was like 50 like this.
Yeah.
I want to be sitting up and be like, yeah,
Yeah,
look at
that's
this.
good, right?
So that is probably very dependent on the skill set. And it's a skill set that a lot of people tend to neglect, which is looking after your health. Because when you're young, you're invulnerable.
Exactly, right.
You can do whatever you want. You can have as many injuries, you heal, it's fine. But those injuries come to pay you back when you get older.
Yeah.
And that's what you tend to see.
And that's why I was more the logical side of my brain was like, that's where I need to end up 20, 30 years down the track.
Well, let's
And
talk
it's also,
about
I
your
guess-
passion, though. So
Yeah.
your passion's like, I still want to help people.
I think the passion side of me is like, I still want to help people, but again, that can be channeled in other ways, right? But generally speaking, like, I do want to keep my hands busy and I do still want to be hands-on.
Yeah.
Which is what I really like, and that's why I really like dentistry as well.
Right.
Because it's very hands-on.
Sure.
But again, like, to be able to help people, I don't need to do it just by doing, like, dentistry per se, but that's generally what I'd be saying, yeah.
Well, the reason I ask that is there's kind of an aspect on where you spend your time.
Yeah.
So as a dentist, you can, if you let's take the extremes.
Yeah.
If you specialize as a dentist and you become, say, a Max Fax, you're going to put another 8, 9 years into education.
Yep.
5 years of medicine, probably 3 years, and then another year or so learning. You're basically investing in you working more.
Yeah.
Right? Like, the only way to make that return on that investment now is for you to physically do the work, because as a specialist, no one else can do that work.
For you.
As a general dentist, you have the ability to do more, but you also have the ability to also delegate it to other general dentists that have interest in that field.
Yeah.
And that's a bit, I think, if you're looking at whether you should specialize or not, which I don't think you are anymore, but if you were, that's a bit that we need to knock out of the picture one way or the other.
Yeah.
So you want to specialize, it's fantastic. Like, you're going to do the hardest of the hard cases and going to be the leader in your field.
Yeah.
But every hour you put into education and to learning is on you working.
Yeah.
So you need to be okay with that.
Yep.
And that's fine if you're super passionate about what you're doing.
Yep.
That's the way to go. The other way is general and practice ownership is I guess the other bit that you're alluding to.
Yeah.
Is, do you buy a practice and have other people do the work? It's a different skill set.
Yeah.
Different skill set. And it's a skill set that needs to be learned.
Yeah.
I thought I knew it when I bought the practice.
Yeah.
But I had no freaking idea what I was doing. Like, absolutely no idea what I was doing. And I made every mistake under the sun. So, in terms of your specialty to non-specialty, I think you've thrown out doing specialties?
I think so. I think that's kind of off the cards at this stage.
Well, that makes it easier, because we've cut out half of what you want to do. Now, you want to do more complicated work.
Yeah.
And so there's this rule in life. I call it the ultimate success formula. You want to know the ultimate success formula?
No.
Do you want to know it?
Yeah, I do.
It's really, really, really simple. But this will get you to achieve anything you want in life.
Okay.
You need to know where you are now.
Yeah.
You need to know where you want to be.
Yeah.
So where are you now? You're working 2 days public, 3 days private.
Yep.
3 days in a field that you kind of want to do.
Yep.
2 days in something you don't really want to do long term.
Yeah.
Right? Where do you want to be? You want to be doing full mouth rehab from complicated work.
Yeah.
The next bit is you need to take an action.
Mm.
Any action. It doesn't matter what you do. You either quit your private work and do all public, or you quit public and do all private, or you take 1 day off and do study. Like, it doesn't matter what you do. You do one of those things, and then after a few weeks, you assess, is this getting me closer to where I want to be?
Yeah.
Or further away to where I want to be?
Okay.
Right? Now, some of these you don't need to do in physical terms to understand the answer, right?
Yeah.
Like, if you quit your private job and went full-time to public,
Yeah.
would that get you closer or further away from your goal?
Very further away.
Very further away, right? And so, that's something you don't want to do.
Yeah.
So increasing your time in public
Is like not ideal.
Is not ideal.
Not gonna get us there.
Well, let's do the inverse then. If you stopped doing public and took more time in private, would that get you closer, further away, or no change?
Oh no, that would get us probably closer.
All
That would
right.
get us very closer.
All right.
Because we'd be much more in the environment. We'd be doing much more of the stuff that we'd be seeing more of the patients we want to see and all that kind of stuff as well.
Right. So
Yeah.
that's kind of where you want to go.
Okay.
Right. So you've already answered your question really as to what you want to do. Now, but there's minutiae to that too.
Yeah.
Right? So rather than going the full extreme, which is let's just go to all the way to your current practice,
Yeah.
maybe you want to do some study,
Yeah.
right? Now, if you took your day, so I think I don't want to put words in your mouth, and I never will,
Yeah.
but if you want to consider taking some time away, you're probably going to take time away from the public arena,
Yeah.
right?
It would definitely be for the public.
So if you're going to take time away from the public arena, your choices now are, do you go to the same private practice?
Mm.
Do you go to a different private practice? Or do you spend your time learning about stuff?
Yeah.
Right? And when I say learning, I mean pure academic stuff.
Yeah.
Because you learn at your practices too.
Yeah, of
But
course.
pure academic stuff. So walk through those scenarios out loud
Mm.
and tell me if it's going to get closer or further away from your goal or be about the same.
Well, I think if I were to, the only way I can see it being feasible to take a day off and do purely academic stuff is if I did like a part-time postgrad dip. So if that's, with either another company or with the university, part-time, that's what I'd be doing. I feel like the time commitment for that would be much more than just 1 or 2 days though. It would be about roughly 3 days. So in terms of, would it get me closer? It will get me, I guess, closer to being certified and closer with the more academic foundations. For example, if we did like a postgrad dip in implantology, it will get us closer to getting into that area. But there is that cost benefit of, I will be studying 3 days, there's a cost for the education, and there's also a financial cost of, I guess, the not working as many days as well.
Yes. Which is significant.
Yeah, it will be a big amount as well.
But I guess what we're talking about now is delayed gratification, right?
Yeah.
Short-term pain for longer-term benefit.
gain, yeah.
So the question really is, what long-term benefit would you get practically from doing a grad dip for you?
Well, if we did like, let's say, a grad dip in implantology, for example,
Yep.
be able to place implants, which would then get me closer to my goal of doing much more complicated work, whether that's implant placement or whether that's, all on however many.
Yep.
And like you said, there is that financial reward later on as well.
Sure. Could you not place implants without a grad dip?
You definitely can.
So what is the grad dip giving you?
Somewhat of an academic foundation.
Yes.
So you're getting the theoretical knowledge.
So what does that give you?
It gives you the confidence to make sure you're placing implants safely and
Okay,
properly.
perfect. So it gives you confidence?
Yeah, but the main other thing is you're getting essentially a piece of paper. You're getting a certification that says, yes, I've done further study to now probably place implants, and I've spent 12 or 18 months studying this, so I can do it. And this is the kind of evidence to show that I can.
Yes. And what does that bit of paper give you? Let's be really clear.
Realistically, probably not much, except adds a couple extra letters to your name.
Well, it adds extra letters to your name, which is part of the confidence. But I dare say it gives you legal standing to place implants.
Yeah.
That's probably what it really gives you, right? So if someone complains and says, DK, you shouldn't have placed implants on me, what right do you have in placing implants? You pull out the bit of paper and you say, here's my evidence. You've got to be careful with some of the academic work, though, because there is something called analysis paralysis.
Okay.
Wherein you know too much of what can go wrong, you tend to hesitate on doing anything at all because you go, well, this could stuff up, or this could stuff up, or this could stuff up. I'm not saying it's a bad thing, it's just something to consider to
think about.
That some people that do these grad dips tend not to place as many actual implants.
Yeah.
I don't know if there's any research as to why that's the case or not, but I don't know if it's inverse in the confidence. There's a bit of, the Dan Kruger effect. When you don't know enough, you tend to put yourself into risky situations. You think you know too much, or you think you know enough. And so you tend to do more advanced procedures and make mistakes and learn from them. Yep. Where when you have the knowledge, you're probably safer, as you so said, but your development can be stunted because you are safer.
Yeah.
I'm not putting any disclaimers onto if I think this is better or worse or anything like that. I'm just saying that's just the way it is.
Yeah. Okay.
So you've got that. So let's go to one of the other options.
So the other option is just to go full-time private.
At your current
practice? At either my current practice or over two
Well,
practices.
let's break them up.
Okay.
So what happens if you go to...
So I think if I go to... I'll be gaining much more practical experience.
Yes.
So that'll be very, very good.
Just phrase that.
What I'm concerned about going full-time private at that I've had to kind of build my books up from scratch because I haven't been taking over a complete full set of books. So at 3 days now they're quite busy.
Yep.
But if I were to go full-time at what I'm worried about is I'll be there 5 days, but I won't be busy 5 days. So I'll then need to go through that extra time to, build those books up. That could take another 6 to 12 months to get it, to a consistent level.
Yeah.
One of the other restrictions which I feel of being at that because I'm aware is a very different clinic, especially when talking to my peers and colleagues, I feel like the experience I'm getting is a very different experience to what is, I guess, a more standard or realistic experience you get at other clinics.
Right.
Whether that be good or bad.
What do you think is a difference in the experience? Or what have you heard is a difference in the experience?
Just in terms of the way clinics are run, the kind of treatments we offer.
Well, let's get specific. What is it that you're saying? Is it run better or worse? Is it... let's not put it that way. How is it run that makes you think it's different from other clinics?
I think it's run very favourably for me personally. So I've got a lot of autonomy, a lot of flexibility. I don't really have any restrictions in terms of materials, products we use, anything really.
Right.
I have practically complete autonomy of what I do, what I use, all that kind of stuff.
Mm-hmm.
In terms of the treatment that we do as well, I think obviously we do a lot of cosmetic work, we do a lot of full mouth rehab work as well.
Yep.
Which, I don't know, this might just be me being naive, but, I guess a lot of other clinics wouldn't be doing that, and I met quite a few colleagues that that's something that we would just refer straight out,
Yeah.
And it's kind of even simple things like that I would have thought aren't too complex. They're like, no, we don't touch that.
Like what? What's it?
Just simple cosmetic work, for example. They just kick straight out. Looking at doing, more than 5 to 5, they're just like, nope, that's till pros. So I think we do a lot of that stuff in-house, which has been really good for me because I've been able to learn a lot and observe a lot as well. Like having a perio, at the clinic as well has been really helpful. Just jumping on his surgeries too, which has been really good, or have him consult as well, which is there's a lot of resources there, I think.
So you've got resources and access to resources?
Yeah.
Are you doing these full mouth rehabs yourself at the moment?
No, not yet.
Okay.
So
you just have the ability to observe and learn
observe, and once I'm confident or once I'm happy to do it is when I can start doing it. They haven't been don't do it. Yeah. It's just a matter of I've said I don't have a lot of pros experience yet because in public, that's the one thing you don't get is pros experience. So I've been trying to do as many crown and bridge, just simple cases as much as I can. Yeah. And they are actively looking for single implant cases that I can restore as well. Right. So little bits and pieces like that. But again, that's all a building process.
Yeah. Dr. Krish is placing his first implant soon?
He did. He told me that. That is very exciting.
That's very exciting.
That is very good. He told me that a couple of weeks ago, actually.
Yeah. So look, it really comes down to your mentor.
Yeah.
Because you're quite right. If the principal dentist or the owner of the clinic
Yeah.
is very risk adverse, then you're right. Those colleagues or those associates underneath them will try and emulate what they're trying to do, which is let's refer it all out. If the owner of the principal dentist is more versed in complex treatment, then they're more likely to help walk you through those kinds of treatments and things.
Yeah.
So, although you're quite right, there are clinics that don't do complex treatments. You can't say that there's only one clinic that does that, and that's not.
Of course.
But what you probably do have is a support structure which is different to others.
Yeah.
Like having specialists on site is very rare for a general dental clinic.
Yeah.
So that's something that's different. And your exposure to the type of work is probably different as well.
Yeah.
So not the type of work, but the quantities of the type of work, I guess. So you're probably going to find that you will see more full mouth rehabs or see more, what's it called? All on X's, than you would at other clinics, and actually see the actual surgeries as well.
Yeah, of course.
So you get that exposure. What would you be missing out, or what would be the cons of staying at, or putting all your eggs into the one
Well, I
practice?
think that's exactly. It's one of the cons would be, I think, because I'm still quite, I guess, fresh into my dental journey. I've always liked the idea of having different people to get different ideas and different opinions and different experiences.
Yeah.
So if I go all in on, let's say, I feel like I'm really limiting myself to, the two principals there.
Yeah.
And what they can offer me. Whereas with the 2 days, that could give me the chance to go to another private practice and then get, exposure and experience in different areas, different aspects, and from different people as well. So I think what I'm worried about is if I stay full time, I'll essentially just learn, I guess, like what they've got to offer, which is like, there's nothing wrong with that, but I won't be able to develop myself and be a bit more, I guess, well-rounded as I'd like to be, because I think I need to be able to make my own decisions and have the justifications as to why, and obviously, like, there's many different ways to skin a cat, but being able to have an understanding of what is the best option or what works well in my hand, and being exposed to different opinions and different challenges, I think is also important, especially since I'm still quite new into the dental journey.
Yeah.
And that's the really big thing that's been holding me back from committing full-time to...
Okay. Well, let's analyze that then. So we've talked about further education.
Yeah.
We know that the cons is you're going to make less short-term.
Yeah.
The pro is that you'll have some legal standing in doing more complicated processes, and you may or may not get extra confidence depending on how you internalize the information that you get.
Yeah.
With it's going to head you towards what you want to really do.
Yeah.
But you're worried that you might be restricted in your knowledge base because you'll only see one point of view for the rest of your career.
Yeah.
So let's talk about getting experience at another dental clinic.
Yeah.
So you said that one of the advantages was you'll get different perspectives.
Yeah.
Talk me through the other advantages and disadvantages of going somewhere else.
Well, I think having different perspective is one big thing, which I think is very important. But also having, I guess, different... I'd say maybe different, like, types of work or different types of cases, because, I don't know, like, I found that coming from the hospital to here, I was thinking, okay, like, I was always going to do max facts, and now I'm like, I really want to do full mouth rehab.
Yeah.
But I think just being in a general practice and just getting, I guess, a different set of clientele, different types of work, just to make sure that, I am heading on the right path could be a benefit. But I don't know, if that's really worth going 2 days in another clinic just to find that out.
So you're saying that even if it shows you should be at your current practice,
Yeah.
the fact that you've tried it and you figured out that's not where I want to be
Yeah.
is going to be some reassurance factor to you.
A little bit. I wouldn't say that's a big part of driving me to like maybe take a different practice.
Yeah.
I think it's the big driving factor of going part-time at two different places is mainly having all my eggs in one basket.
Yeah.
So I think the main driving factor is just being restricted on the perspectives, having different people that I can draw on as well. I think that's the main reason why I'm strongly considering maybe working in two different places.
Yeah.
Yeah, just so I can get more experience, more breadth of knowledge, I think is what I'm after.
Okay.
Rather than, restricting myself already.
Yeah.
Because, that's the main, I think, driving factor at this point.
Right. Now, the trouble is, I mean, it's great. I'm always a big advocate of getting a wide range of information and deciding for yourself what you want.
Yeah.
But you will end up in situations like you were in dental school with different demonstrators.
Yeah.
We had the situation, we had the same problem, you ask two different demonstrators what to do, they give you three different opinions, and you're like, oh,
Yeah.
which way do I go?
Yeah.
So you're at that risk of maybe you'll be in that situation as well.
Yeah.
Where you might end up, I guess, being confused as to which way to go.
Yeah.
How would you reconcile that if you're in two different practices?
Oh, I think that'd be a tough one. I hadn't actually thought about that.
I ask the tough questions. This is why we do coaching in cars.
Yeah. Damn, okay. I think I think it would just be information gathering, to be honest. So if it's two differing opinions from two different clinicians,
Yes.
trying to go to a third source, trying to go to someone else who's like impartial, or trying to go to a specialist and just seeing what their thoughts are,
Yeah.
that's how I'd probably reconcile and figure out which way is the best way to approach it.
Sure.
But yeah, I hadn't really thought about that. to be
Yeah.
honest.
So ask the audience, basically, right?
Yeah.
So the trouble with asking the audience, and it's part of one of my talks where we talk about a bell curve, right?
Yeah.
The audience will be in the center of that bell curve. And some of them will be below it and will
Yeah.
do things that are worse off. But there's going to be a significant number of people that will have a better solution than the ask the audience.
Yeah.
So you need to be careful about asking too many people about their opinions.
Yeah.
Because you will be swayed towards the mean.
Yeah. Okay, gotcha.
And it's good if you're below average, because if you're
Yep.
below average, they'll pull you
To
back
average.
towards the mean. But if you're doing something completely different,
Yeah.
you're going to get a lot of hate and you're going to get a lot of criticism. You're going to get a lot of stuff that's going on,
Okay.
because what's happening is you're doing something different to what everyone else does. And so they're going to be saying, why is he doing something different? It must be wrong, so let me hate on him.
Yeah. Okay, gotcha.
So be wary of asking
Too many people.
too many people,
Yeah.
because it will pull you towards the mean.
Okay.
Another way of doing it is actually doing your own reading and research. You can
Yeah.
always go back to academic papers and experiences. The biggest trouble I have with papers is a lot of the times it's dependent on the clinician.
Yeah.
A lot of what we do can't be standardized.
Yeah.
So what works in my hands may not work in your hands.
Yeah.
Without the understanding of proper knowledge. You can't just read a
Yeah.
paper and be like, well, let's do this, and it'll work, because there might be some minutiae in what I'm doing
Yeah.
that is making it work, right?
Okay.
Like placing implants. Maybe, there's these articles about, placing implants without irrigation now.
Yeah.
And you're like, whoa, like, that's crazy.
Yeah.
But it works for them because they have this procedure that they do. Obviously it's lower RPMs and things, but it might be the type of burr. Maybe they're changing their burr every single procedure,
Yeah.
which is not something that is generally done. But you know what? If you've got a sharp burr, you can go pretty slow and get in
Yeah.
there and come out without causing any heat at all. So there's a whole bunch of minutiae that's hard to pick up from articles, but it's another way of reconciling those differences.
Yeah.
So you're working at two different practices.
Yeah.
You're hedging your bets, I guess.
Yeah.
You don't have all your eggs in one basket. You will generally find that you'll fit in better with one practice than the other practice,
Yeah.
right? It's kind of human nature to compare.
Yeah.
And so what are you going to do in that stage when you find that you like one better than the other, or...
I think that's where, I guess at some point, I guess would you transition full time to one practice rather than the other, or I guess
I don't know, you tell me. Like,
yeah. Like again, I hadn't really thought about that to be honest.
This has been valuable for you, I can tell.
No, you can tell by my stunned face every 10 seconds. I'm like,
So
okay, yeah.
Because you're going to have an awkward conversation with one or the other.
Yeah.
But let's just look at you to begin with.
Yep,
right? So again, the ultimate success formula to life.
Yeah.
You need to assess which one's going to get you closer to your goal or not your goal.
Yeah.
Right? And there's different aspects to it. Right? Because you said that you want to do a little bit of clinical,
Yeah.
but eventually you want to get into like ownership as
and
well.
the
And the business aspect too. So you might want to look at it and be like, well, I might want to do all the clinical stuff of your current practice. I don't know anything about them really, but maybe they're owned by a corporate group,
Yeah.
and there's no way that I can ever buy into that practice.
Yeah.
Right? That's going to give you extra thought factors now, because you're
Yeah.
like, sure, I can get all the clinical stuff, but my ultimate goal is to do whatever.
Yeah.
Own a practice and sit there doing complex cases.
Yeah.
While in another clinic, you know what? Maybe there's a possibility of owning it.
Okay.
Or you might be like, well, I'm going to go out on my own and set up my own shop and
That's
start
something
from
you
scratch.
Yeah.
So you've got all these possibilities. So again, the current issue we have with life is that there's too many options, right? You actually have too many options.
Yeah.
So you get into this paralysis zone, like, I don't know which way to go, because they're all kind of good options.
Yeah.
So at that point, you'll do the same analysis as we're doing now.
Yeah.
You'll sit down and you're like, all right, if I do this, it's getting me closer and further away. If I do this, it's getting closer and further away. Now, you can only do so much of this theoretically.
Yeah.
At some point, you're going to have to practically jump and do something,
Yeah.
and then make that same assessment.
Okay.
Now, the reason people get into ruts in life, you know what a rut is? It's like,
Yeah, it's like when you kind of like mellow out and
mellow out and they don't really get to where they wanted to be eventually,
Yeah.
is they stop doing that analysis.
okay.
Now, some people never do that analysis. They just like fall into something and they do that forever.
Yeah.
And at the end, they're like, man, I'm really unhappy. Like, why am I in this position?
Yeah.
And the reason was that they never did that analysis where they're like, what do I do?
Yeah.
Right? What do I, sorry, not what do I do, is like, where am I now? Where would I like to go? And is what I'm doing now getting me closer or further away to where I want to go?
Yeah.
So I'm going to suggest that you do that more often,
Yeah.
and you assess yourself on a regular basis as to where you are. Now, you can change your goals.
Yeah.
There's nothing to say you're set in what you decide now. So sometimes, you know, when I asked you the first thing, what do you want to do? A lot, you know, you were like, I don't know, like,
Yeah.
you kind of just have to pick something that feels good to you at the time,
Yeah.
and then you can refine as time goes on, right? You might have wanted to be a oral surgeon, max fax kind of a guy, but now you've changed your mind. You're like, no, I don't,
Yeah.
and that's okay too. Like, you don't have to do the same thing. So it's okay to change your goals. So at some point, you're going to be like, I need to decide which way to go.
Yeah.
And at that point, you need to have the discussion with whichever party it is, so that you want to leave as friends.
Yeah.
I guess is the way it is. There's no real easy answer to that. It's really about being open and upfront as
Yeah.
early as possible, because really, as a business owner, all you really want to make sure is your business isn't suffering because of somebody else.
Yeah.
Right. So, and if they're reasonable people, and you say, look, in the next 6 months, I'm probably going to be leaving.
Yeah.
Then you're like, well, 6 months, all right. You know, we can find someone to replace him. We can train them up.
Yeah.
We can, you know, start weaning patients off him. We'll make sure he doesn't start, you know, super large cases, you know,
Yeah.
1 month out. You know, you'd probably want to do the same thing yourself, but that's probably the way you want to go.
Yeah. Right.
And then you want to transition to wherever you want to go.
Okay.
Eventually, and you're going to hate this as a young person, but eventually you're going to want to put all your eggs into one basket.
Yeah.
Right? You're going to have to do it.
Yeah.
You can't always be hedging your bets.
Yeah.
Look, I can't say that. You can hedge your bets, but at some point it'll become inefficient to do so.
Yeah.
Right? So at some point you'll be like, I should have, if I work more at my, saying, for instance, let's pretend you have your own clinic.
Yeah.
At some point, you'll be like, is it better for me to work in my own clinic or work for somebody else?
Yeah.
Like, I'm not sure which one's the way to go.
Mm.
But you might do the same analysis in life and be like, well, what do I want in life? Maybe you want a fancy car.
Yeah.
Maybe you want a nicer house. And you'll be like, well, financially, it might be better to do my own practice.
Yeah.
And you'll get more efficiency by putting more time to refining one system rather than multiple systems.
Yeah.
But you don't have to do that yet.
Yeah.
So it's okay. When I first graduated, I worked in one practice, and we did like the complete opposite to what we did now.
Yeah.
I think I might have told you this. We saw 30 patients a day. It was just
Yeah,
amalgam fillings, no liners, extractions.
Incredible.
You know, that whole lot. Oh, it's sad. There's cars in front of us. Fine. I should do this on like a weekday in the middle of the day, so we have the roads all to ourselves.
Oh, it's so good though. It is just so grippy, honestly.
It's so grippy. See, cyclists, whether on cars or on bikes.
It's bloody annoying.
If you're a cyclist, ignore that entire statement. Ignore it all. Yeah, so where were we? So at some point there'll be some efficiency. So
Yeah.
when we did the complete opposite of what I'm doing now, and I didn't know there was better ways, right? This is pre-Facebook era even,
Yeah.
so there was no way to ask people like what's going on, and so what I did was when it was brought out by another group and I didn't like what it was, I took 5 different jobs.
Yeah.
I was working a day a week at a different place just to figure out what I wanted.
Right.
And then the one I wanted more, I'd cut down on the one that I didn't like and go towards that one, and then cut down again and go towards it. And I did it quite openly and transparently. I'd give them plenty of notice. I'd say, this is what I'm doing. Even when I bought into the practice that I'm in now, it was a very small practice, but I was working in a practice that was probably 20-minute drive away.
Yeah.
Even at that point, I had full disclosure. I said, look, this is what I want to do. I want your blessings. And they gave me their blessings. And I said, look, I'm even happy to go into partnership if you want to go into partnership.
Okay.
So I was like completely transparent the whole way through, and there's no ill will about that.
Yeah.
You know, completely different to what, you know, some people think is the way to go, which is, you know, where you're secret and you don't tell people because you're scared about what they're going to do. At the end of the day, no one can really stop you from doing anything. And so sometimes it's nicer to be friends with your neighbors than enemies.
Yeah.
It's just my, I guess, point of view on that. And so eventually I had my own practice, and I had a choice as to what I should do. And my mentor at that stage told me the story of Christopher Columbus.
Yeah.
I told that story?
No.
No? So Christopher Columbus comes to America, and it's hard. There's locals trying to kill them. They can't grow anything. The weather's all not what they used to. Nothing's familiar. There's no mod cons, right?
Yeah.
They're just living in these shacks. And his crew were like, come on, let's just go back home. This is too hard. Let's just go back home. This is too hard. And you know what he did?
What?
He burnt the boats.
Right.
Motherfracker burnt the boats.
Okay.
You know what that did?
Well, they couldn't go back home anymore.
Well, yeah, so you know what? They had to put all their efforts into succeeding.
Yeah.
And now America is what it is now, for better or for worse. Right? But he succeeded in what he wanted to do, which is colonize another country.
Yeah.
Right? And that's what happens when you hedge your bets too much.
Okay.
Eventually you need to burn your boats
And you got to figure out.
and figure out where you want to go and put all your efforts into that one thing that you think is your way of getting to where you want to go.
Yeah.
And put your efforts to it.
Okay.
Because if you always have a backup plan, you're like, look, it'll be okay. I've got, you know, this other clinic. I've got whatever it is. What you'll end up finding is that you won't push yourself very hard.
Yeah. Okay.
Right? There's something about survival and needing to make it in order to survive that gets people like really, really, really motivated.
Yeah. Okay.
Alrighty. So,
Jeez, I had not thought about any of that.
so what are your thoughts? What are your thoughts now that we've talked about all of that?
It's added a layer of complexity, that's for sure.
Well, yes, it has. Has it added any layers of clarity?
I think a little bit. I think it's told me that I don't think staying in public long term is the way to go.
Okay. So we're clearing that off.
Yeah, I think that's also coming
So
out.
we've cleared two options. We've cleared specialist.
Yep.
And we've cleared public.
Yep.
And this is important. Choosing an option
Yeah.
is as much about removing what you don't want as about picking what you do want.
Yeah.
Right? So we know we don't want those two. So we've got two options left.
Yeah.
Oh, three options left. How about academia? Doing some study. Is that something that on the table, not on the table?
It is at the moment, but I think I'm already doing I've got to finish off.
Yeah.
And then I'm also doing the postgrad dip in ortho as well.
Okay, yeah.
So I think that's probably...
So you're already kind of
already kind of in it.
Okay.
As much as I'd want to be at the moment.
Yeah.
So I think the academia at this stage is kind of covered.
Okay. And so then your options are...
Yeah.
Do you go all in on your current practice?
Yeah.
Or do you look for another practice?
Yeah.
What are your thoughts on those two?
That is where I think it's a bit more complex in that. Yeah, I'm still a bit uncertain on which way to go with that. Because I think you're right in the sense that at some point I do need to pick a boat and just go with it, right?
Yeah.
But I feel like at the moment it might still be a little bit too early for that.
Yeah, especially if you don't know exactly.
Yeah.
Because the wording is going all in on something that is not you.
Yeah.
Right? And then you waste a heap of time.
And then I'm like, stuck with it, right?
Yeah. Well, you're never stuck with it.
Yeah.
There's an opportunity cost of coming back. Like, I spent 4 years at this other clinic that was doing work that I wasn't, that I didn't feel great about. And so I lost 4 years of advancement.
Yeah.
Just because I didn't know there was another way.
Yeah.
Do you know what I mean? Well, if I had done that earlier and had been to multiple practices, I might have known, actually, that's probably the better way, or that guy's a better mentor, or a guy, girl, whatever it is, they're a better mentor. And so, early on, you kind of want a bit more variety.
Yeah.
But carry on, yes.
I think that's the main thing. I think is.
So what's scaring you? Because I hear hesitation in your voice.
No, I think it's more the fact that I just hadn't really thought about going full time at till we kind of brought it up just now.
Yeah.
I think in my mind the choices were always either keep public or do 2 days private.
Yeah.
Whereas now it's kind of like public's, I think, happy to say that's like not on the cards anymore.
Yep.
So I'd say it's more, do I go all in on at or do I go 2 days somewhere else? Yep. But I still think, like, just thinking about it at the moment, I think it's still a little bit too early to go all in. I think at some point I would, if I keep doing the work that I'm doing and if I keep heading in the direction I want to go.
Yeah.
But I don't think at this stage it's necessary. I think it's still better, especially being so early on. I think having that, like I said and alluded to before, like that breadth of experience as well.
Yeah.
I think it's something that I'm still kind of looking for at the moment.
Yeah. Okay.
And I don't think, even then, like, this is something else that I hadn't really spoken about, I've really thought about, but what you had mentioned before about what you would like to do in the future, which is, I think what I alluded to is, I would like to own a business at some point.
Yeah.
Is not an option in that regards. So
okay.
That is not going to happen because it's corporate owned anyway.
Right, it is? Okay.
Yeah. So that's, that's not going to happen. So further on down the track, it would need to be something else anyway. So even though I say go all in, it wouldn't be in a business perspective. It would be like just as a associate perspective. But again, I feel like I'm saying that now without having had that breadth of experience, because the only private I know is stuff.
Sure. Right.
So I don't know what other privates are like, and I don't know if, like, I only know what's best now because that's the limited exposure I have.
Yeah.
And it's just
you don't know what you don't know.
Exactly, right?
Yeah.
And it's been fortuitous that it's a nice clinic. The team's really friendly, and
Yeah.
I've got a lot of autonomy, and there haven't really been many issues, right?
Yeah.
So I've been like very fortunate in that regard. But again, like you mentioned, my scope is this big,
Yeah.
and if you're in it through a very, I guess, like lucky perspective,
Yes.
that's all I can really
Yeah.
assume right now, right?
Yeah. And look, and do you want me to complicate your matter a little bit
Go for
for
it.
the future? I don't generally like to complicate your lives, but I think you've got a head that can take on multiple variables.
Oh yeah, don't worry, I'll be dreaming about this next couple of nights.
Right. So what you need to think about is, if your goal is to own a practice one day, and you can't do it at
Yeah.
if you do go full time
Yeah.
and your patient base is at
Yeah.
what happens when you leave it
Yeah.
to do whatever you want to do, right?
Right.
You're going to have to start from zero again
Yeah.
to build up a patient base.
Okay.
Now, I think it takes about 5 years to get a very loyal patient base in a clinic.
Yeah.
So you see people enough times, they come back, they basically trust you implicitly, and they'll do pretty much everything you want. Now, we can ramp that up with power-ups and by communication techniques and things like that. But if you just do nothing else,
Yeah.
5 years is how long it takes just to be there enough times for people to see your face in order to get to know you. Now, if you're 100% at one clinic and then you leave that clinic, the number of patients that will follow you is not as much as you think,
Yeah.
right? It's really not as much as you think. There's more loyalty to the clinic than there is to the clinician.
Yeah.
It's funny because as owners, we think it's the other way around.
Yeah.
But there's been plenty of examples where people are set up next door or wherever it is, and they keep going back to that clinic, especially if they're a preferred provider.
Yeah.
Preferred provider clinics themselves have so much loyalty, and so you need to consider what that transition will be like eventually
Yeah.
when you're looking at either starting a practice or buying into a practice.
Yeah.
You will have to start. Oh shit! Look at that pothole.
No, it's huge. There's so many around here.
There's that you're going to have to start from scratch again.
Yeah.
And are you willing to take that hit?
Yeah.
Or you'll have to do the inverse of cutting down your practice.
Yeah.
But my recommendation to anyone starting their own practice is to go all in.
Yeah.
Burn your boats, because you want to ramp that up
Succeed
as fast as possible. You've just pumped so much fixed expenses into that place that you need to ramp it up as soon as possible.
Yeah.
Now I'm going to touch on something that you alluded to, which is wherever you go, whether it's a or another clinic, you're going to be quiet to begin with.
Yeah.
And you're like, I don't want to be quiet to begin with.
Yeah.
I'm going to say, suck it up.
Yeah, that's...
Right? There's a fundamental... Dentistry is a timing game.
Yeah.
And a lot of new grads, or even dentists in general, don't understand this. You need to see a patient now in order to see a patient tomorrow.
Yeah.
If you're not at a place now to see a patient, you're not going to have another patient to see tomorrow unless it's a brand new patient that's coming to the clinic.
Yeah.
So unless there's a huge number of new patients coming into the clinic,
Yeah.
you will eventually run out of new patients coming in
Yeah.
if you're not able to get a patient that you see now to come in tomorrow.
Yeah.
Better yet, if you see one patient now to be two patients tomorrow,
Yeah.
two appointments, or them getting a family member or a friend to recommend you or whatever to come in, you're going to be quiet.
Yeah.
So we hear on like a lot of social forums, dentists complaining about, if I'm quiet, I want to go home, I don't want to be there at the clinic.
Yeah.
I mean, I have a quiet, little chuckle at that. Because I'm like, what they don't realize is they're going to not be very happy at that clinic in the near distant future.
Yeah.
Because if they're not there, that emergency that's called up, then they're like, can I come in now? Where they would have seen them is now not being seen. And if you're good at communication, then that emergency patient is now, your patient, and is now 6 appointments or whatever it is, which they'll recommend their friends, which will be 6 more patients. And all of a sudden you get this snowball effect as to what's going to happen. So wherever you go, you're going to be quiet.
Yeah.
What your talent needs to be is how to make one person into 10 as quickly as possible.
Okay.
Right? So if you can make one person into one person, that's okay. I mean, one person to 2 people, you've just doubled it up.
Yeah.
But 1 people to 10, that's logarithmic growth.
Yeah.
Right?
Okay.
That's literal logarithmic growth.
Yep. Yep.
And so you're going to like expand really, really, really fast.
Okay.
I mean, that's kind of how, we've got we run a 6-chair practice.
Yeah.
And a population base of 2,000 people.
Yeah.
We can't rely on like a whole heap of new people coming in through the door all the time.
Yeah.
We have to rely on being so good at our communication and what we do
Yeah.
that people recommend us and keep coming in.
Yeah.
So,
Okay.
So no matter where you go, unless it's public,
Yeah. It's
or
gonna be...
or unless you're taking over someone's patient base,
Yeah.
which is also fraught with
Problems
you can't
of its own.
guarantee
Yeah.
it and problems of its own. What do you do when you've seen someone? Well, when they've seen someone for 10 years and they've said everything's fine, and all of a sudden you're like, I think it needs a full mouth rehab.
Yeah.
Right? The patient's not going to think the new guy's right.
Yeah.
You haven't built enough trust.
Yeah.
I mean, you can do it, but you need to be advanced in your communication skills to be able to do that. Most people, the patient will be like, this guy is a ripoff. I'm going to go and find another practice.
Yeah.
Right? And the other thing that happens, it's really weird. So I'm cutting down my days
Yeah.
clinically.
Yeah.
And so if patients can't see me, and I say, look, see one of my associates, sometimes, and it's more often than not, they were like, I'm leaving the clinic because I can't see you. And I'm like, this makes no sense to me at all.
Yeah.
Like, you're seeing somebody else that's not me.
Yeah.
If you come to the clinic, I'm going to be around.
But also, you're like, this is someone you trust to do
That's
your
right.
work.
That's right. If you go to another clinic, you're still not seeing me. So it makes no sense to me as to why that is like a reasonable option for somebody
Yeah.
else. I think it's just they're angry maybe,
Yeah.
and they're like, well, screw you guys in total. If you can't do what I want, I'm going to go somewhere else.
Yeah.
It's like taking some control back.
Yeah.
But logically, it makes no sense to
Yeah.
me. But so that's the only way to get a full book is to find out what it's happening. But it's very hard to get full books on a part-time person
Yeah.
type thing. So that's something else to be aware of.
I think it was something more that it's just been a building process. Again, it's something that me just being naive about private practice, I just didn't realise it would be an issue.
Yeah.
But now that like I've gone through it and I kind of know how to manage it as well, but also like handle it too,
Yeah.
has been like really good.
Yeah.
And now we're like a much better place in terms of like busier books and all that kind of stuff.
So
And
you got
like
some
mentioned-
financial backup as well.
Yeah.
And, yeah.
And like you mentioned, like hanging around is so important because you just never know who needs a surprise feeling or who needs like impressions or
That's right.
who needs like an emergency.
That's right. And what you'll find is that, if you have a gap and the clinic is a good clinic, others will help you fill your own books.
Oh yeah,
Because-
that's been invaluable to be honest.
Yeah.
Because I've always got the hygienists looking out. Well, they've been really helpful.
Yeah.
And they're always looking at like, look, this patient needs a filling. You've got a gap. Can you do it now? Kind of thing.
Yeah.
And if I wasn't at the practice, then that would be a
They'd
lost
be gone.
opportunity.
That's
right.
right. That's
Yeah.
right. And we have that in our clinic, but we have dentists sending work to other dentists as
Yeah.
well, which I think that's kind of rare.
Yeah.
Because most of the time dentists want to keep everything for themselves, right? It's their margin and their earnings. But I guess if everyone's busy enough, people
Of
are
course.
happy to send stuff that they prefer not doing
Yeah.
to get stuff that they want to do.
doing. Yeah.
And so that's kind of where it's at. So hopefully that's given you some kind of clarity.
No, I think
And some more
actually
confusion.
Really, it's challenged me and it's made me think about questions that I had not even realised existed, to be honest.
Yes. Good.
But with that has brought some clarity as well in the sense of what direction that I want to go in as well.
Yeah.
So it's been really good.
And you don't need to make a decision straight away.
Oh yeah.
So a lot of the times you need to let this little thing, your little computer up here, process it.
Let it marinate for
Let
a
it
couple hours,
marinate.
a couple of days.
Yeah. And all of a sudden it'll just throw out something at you. And
Yeah.
you'll be like, huh. Like,
This is good.
how did I not think of this before? Like, why was it not so clear?
Yeah.
So I never try and force things. I just give it as much information as I need, like consume information, let it marinate, and then eventually it just pops out something that you're like, oh, okay.
That's why, I don't know if Krish mentioned to you, but I went for a couple of interviews before I went to Bali,
Yes.
and I went in, and they were fine, and there were some opportunities. For example, I went to a clinic in that was a small family dentist, and they had said that I guess they bought the practice when they were young, and now they're getting old, so if you're there's an opportunity to buy into it later, that kind of thing. And then I went to another clinic, and they were look, like looking for a part-time associate and blah blah. But every time I went in, I just wasn't sold, and I didn't have like a good feeling about it.
Right.
And that's where I would just chat to Jesse more and more, being like, what am I missing here? Like, what am I not seeing, or what am I, like, why doesn't this feel correct?
Right.
And that's why, like, I was just chatting with Jessie, and she's been trying to give me ideas or, like, solutions or, like, different options available.
Yeah.
But,
Look,
yeah.
You've got to go with your gut feeling sometimes, too. You know what a gut feeling is?
Well, it's kind of like, you know, your body telling you, or your instinct telling you, like, yeah, this is good or this is not good, or stay away, or
do you know how it's developed?
I'd say through survival mechanisms, but that would be my guess.
Yeah, it is through survival mechanisms. What happens, right? And I find this fascinating. What happens is that our brain takes in a lot of information, right? We're actually consuming every bit of photon that's coming through our eyes.
Yeah.
But we chunk it down to, there's a road and trees.
Yeah.
Unconsciously.
Yeah.
But there's actual information that our brain is digesting and like throwing away. What a gut instinct is your body reconciling all these, I guess, raw data and giving you a feeling that is congruent or non-congruent with what you've been told or your conscious brain is saying.
Yeah.
So if someone's saying they're a really nice guy and they're amazing, and you're picking up these subconscious vibes, like, I don't know, the way he stands or the way his eyes are shifting around or whatever it is, you'll get this like feeling and you'll be like, oh, my gut feeling's like not so great.
Yeah.
And so I say trust your gut feeling.
Yeah.
Because it's the congruency of the raw data that your senses are taking in that are telling you, is it right with what your conscious brain is thinking or not?
Yeah.
That makes sense?
That makes sense.
Yeah. So I put a big value on gut feelings. So if your gut feeling says nah, then it's probably nah. You'll always. It's like if you're dating. You know, if you ever date someone and it's not right at the start, it usually just gets much, much worse. Yeah. It's very rare for it to like flip itself around and you be able to change them and everything to be hunky dory.
All of a sudden, yeah,
you're like, that's
it's only getting worse, not better.
That's right. So that's similar to what to what that is. But that's interesting. So look, if you're getting a bad gut feeling, I'd say do some analysis for your own benefit to see what that is.
And I think that was the link I was kind of missing, because I knew that it wasn't right for me, and I was like, when I said no, I was like, I didn't have any regrets or anything, which is good.
Yeah.
But then I think I was missing the point of why it didn't feel good, or why it was feeling not correct.
Yeah.
And I couldn't quite figure that out. But talking about this a lot more has highlighted some of the things that I kind of picked up during those interviews or during those opportunities. And I'm like, it's now starting to click, being like, this is why I didn't feel like 100%, or this is why, I wasn't happy with that opportunity that was there.
Yeah, right.
Yeah.
There you go.
There you go.
Excellent. Well, there you go.
This is good. Thank you very much
Coaching
for your time.
class. My
I
pleasure.
appreciate it.
And I'll see you guys next time.